Treating equine gastric glandular syndrome, created by Medrigo. Equine gastric glandular disease, also called EGGD, is ulceration in a horse's stomach in the ventral glandular region. It is also known as equine gastric glandular syndrome due to its complicated nature and many causes. Diseases of the stomach are differentiated by region. If gastric ulcers exist in a glandular portion, in the stomach's ventral region, then it is called the gastric glandular disease. When the disease affects the squamous portion, it is called the equine squamous gastric syndrome. This term refers to the disease of any portion of the stomach. Causes of EGGD. There are two factors that result in the cause of this disease. The first factor is the degradation of bacterial colonization, mucosal defense, inflammation, and stress. The other factor is that the glandular mucosa is constantly exposed to hydrochloric acid. Clinical signs of EGGD. Signs are present regardless of the intensity of exercise. Common signs are loss of appetite, changes in hair coat, weight loss, underperformance, and poor behavior. Sometimes diarrhea and erythemus are present along with signs as well. If you find any of these signs after EGGD confirmation by endoscopy, further differential diagnosis is needed to treat the hindgut problem. Diagnosis of syndrome. EGGD is not diagnosed based on its clinical signs because they are not considered reliable. The response of salivary cortisol and blood sucrose to adrenocorticotropin was considered useful in diagnosing EGGD. However, modern studies show that both tests are not reliable. The only reliable test is the endoscopic examination. It allows visualization of a lesion for a definitive diagnosis. Risk factors and prevalence of EGGD. The prevalence of this disease is variable and depends on different factors. Many studies are done around the world, and the results were different. In Australia, EGGD is reported in 47% to 62% of racehorses. In Denmark, it is found in 27% to 33% in endurance and 57% of the mixed horse population. Another study that was done on thoroughbred horses identifies risk factors associated with EGGD. It was found that the risk increases with different trainers and horse gender. Also, horse not fed hay and no grass turn out, as well as horses in close contact with each other, horses fed raw grain, and incomplete diet. Treatment of the EGGD. Depending on risk factors involved in the disease, reducing the duration of exercise can help slow the development of the disease. Other than that, if you can minimize a horse's stress condition, it will result in decreased EGGD formation. In addition, a decrease in grain concentrates and an increase in pasture share can be useful in EGGD management. Another natural way how to help your horse is with Black Balance gut supplements by Medrigo. They have been developed to balance the intestinal microbiome as close to its natural state as possible. It is done by using only natural ingredients including healthy humic and fulvic acids. They are improving work of the stomach and intestinal microbiome. Also, absorption of nutrients from the gastrointestinal tract, and removing heavy metals and free radicals out of the body. Black Balance by Medrigo has shown improvement and even complete healing of squamous and glandular stomach ulcers after 3 months. For now, the most popular treatment option is omeprazole. Its job is to suppress acid production for about 12 hours, which can promote healing and provide relief from squamous ulceration. However, in the glandular region, it is not as effective. Most veterinarians are against using any of treatments alone, because they will not give the desired result. Therefore, always use it in combination with omeprazole and mucosal protector. Conclusion. Equine gastric glandular disease, also known as gastric glandular syndrome, is a common problem in foals and horses. Its clinical signs are not specific, so it is only diagnosed by endoscopy. Always consult your vet before using any medication to avoid any problems. Learn more about horse stomach problems and their management by visiting medrigo.com.